Hi, I'd like to talk to you about antidepressants. Now, I have struggled with depression on and off through most of my life. It started in my teens. It's kind of a family problem. And it was brought on by a combination of factors, which included bullying, to which I my parents tried to be supportive about it, but they didn't know, I think, the right way. And it's really hard for parents, especially if they haven't gone through it. My dad never went through depression. I'm not sure if my mom had gone through depression at that point in her life, although I suspect she probably had. But they tried to be supportive, especially my mom, because she was aware of it much earlier than my dad. But between my parents' divorce, or separation and divorce, bullying, and my struggles with trying to come to terms with religion, it all, along with other factors, really was very problematic for me starting at a young age. And looking back in retrospect, having the experience, and perhaps a little bit of wisdom that comes with age and experience and so on, I came to realize that I had, in a way, overreacted in the situations of bullying. Whereas, unlike some other people, perhaps, not everybody was bullying me. In fact, it was only a minority of people that were bullying me. And I had good friends at school. But I focused too much on the people who didn't like me. And I think there are specific reasons behind that. But the problem is still that I was not able to, instead of focusing on the minority of people who were harassing me, to focus on the majority of people who were either neutral toward me or nice to me. Yeah, it made it worse than it was. That isn't to say that I'm not trying to minimize bullying. Bullying is a significant problem that leads to a large number of suicides amongst both bullies and victims. It also leads to a lot of victims becoming bullies and it's like a virus. It spreads and makes our whole country worse when it remains unaddressed appropriately. And we do have to remember that many times bullies, and there are exceptions, but many times bullies are a product of their environment. They, at home and or in their neighborhood and or in their school, become that way because they have been abused. And so we take on, as part of our identity, what we are taught, whether we like it or not. It becomes part of who we are, because at some point our brain switches over and says, okay, I guess this is normal. I guess this is the way that my brain is supposed to behave, because my friends are saying that is true, or my parents are saying that is true, or my grandparents are saying that is true, or my teachers are saying that is true, or the politicians that are saying that is true. So I guess this is the way I'm really supposed to behave. And before I was wrong. So when we deal with bullies, we have to remember they are also, not always, but mostly, victims. And they may not even have any memory of being victimized. Now, there are people who are, from the very start of their lives, destined to be evil. And this is, I cannot even guess as to what percentage of the population is by default already in that mode of abuse toward others. But there are people who are from birth like that. But I'm not saying that a majority or even a large minority of bullies are like that. I believe firmly that many, if not all, bullies are created, not made. So anyways, I'm digressing. Getting back to the topic of antidepressives, I have in my life taken several antidepressives. My kids have as well. And so I want to share with you some experiences, and I want you to understand that when you take a medication, you have to be aware of the contraindications, the conflicts between different drugs, and between drugs and food. Like if you're on a heart medication, you should not be consuming grapefruit or grapefruit juice, because it can change the way that drug behaves in your body. It can make it stronger, it can make it weaker, but the point is that you should always be aware of what you're taking and what the risks are and how to identify when you are suffering from those risks in a way that is unacceptable. So, and I'm going to be very plain here, so there's some adult kind of material in this. So if you could please, if you're a minor, please have your parents preview this or watch with you so they can discuss with you to help you to understand. I am not telling you do or don't take antidepressant medication. I believe that when appropriately prescribed with careful consideration to your specific mental health issues and your needs and allergies and stuff, it can be extremely helpful. But it is very, very easy to inappropriately prescribe medication, and doctors are not trained to do it right. They are trained medication, surgery, because those are moneymakers. So you have to be very, very careful when you go to a doctor. Just because they're handing out pills does not make it a good thing. You should not be demanding pills, and they should not be automatically prescribing pills. You should have a discussion. You should have a clear understanding. And I understand for some people, this is extremely difficult. It is extremely difficult for some people because you have been given a poor education, or you have been given an education that has been deliberately manipulated to make you easier to victimize, or you just are not particularly intelligent about this sort of thing. And so it's hard for you to know the difference between when a doctor is prescribing something that's appropriate or inappropriate, and whether the risks do or don't outweigh the benefits, for example. So I'll start with the first one that I had, which was back in the 1990s, I believe it was. And I was given a medication called nortriptyline. And I have enough understanding of psychology that I have certain advantages that I think some people don't have. But basically what happened was I was pretty depressed. I was thinking about suicide. I mean, sometimes it was ongoing for hours and hours and hours. There were times when I would be in the shower and I would just become so depressed I'd just curl up in the bathtub and cry, and the water would get cold, and yeah. So when I took the nortriptyline, what it did for me, and again, I'm not saying take nortriptyline. Every medication works differently in every body because we don't all have the same chemistry. We don't all look the same outside. We are not all identical, chemically speaking, inside. Okay? This is my personal experience. It is not a recommendation. Okay? None of these are recommendations. I took it, and it really made a difference in my life. For that period of about 6 months, I was so much better. And I was able to see in what ways I was so much better. I could see how my brain was supposed to be behaving in terms of not being really depressed and being on a, I guess you could say normal, if normal is a very vague word, but in the middle, kind of a neutral, where my mind was reacting appropriately to good things and to bad things instead of taking a deep dive down into depression. And you have to understand, if you've never had depression, there are various levels of depression. The lowest levels are, it's hard for you to even realize that you're depressed. There are various symptoms associated with low-level depression, such as problem sleeping, and dissatisfaction with life. And then when you get into the middle range, it's where you start to notice wow, I'm unhappy a lot. I'm negative a lot. And then when you get to the really bad levels, you start to think about suicide on a regular basis. And when it gets to an even worse level, you start to having a lack of interest in life, even the things that interest you, even the things that you're passionate about. Suddenly you're like, I don't care. I have no feelings about this. I'm just dead inside. And that's really when it's very, very dangerous. But even before that level, and that is not a level that I ever reached in my life, but my daughter did. And before that level, you can reach a point where in your depression, you know you need help. You know you should reach out. You know you should call somebody, but you don't, because it takes too much energy to do that. Now, if you find some solace in being with people, do so. However, if those people make you feel bad, if they drain you of your energy, you need to find other people to hang out with. In your search for respite from depression, you have to walk away from people who are negative and stay away from them. Or at the very least say, look, I am depressed. I came here to be with you because I needed positive support, and you're just tearing me down. I can't be around you anymore. You're making me worse. And if they react appropriately and behave appropriately from that point on, great. But if they keep on sliding back into being in some way or other abusive toward you, disparaging you, making you feel bad about yourself, you can't be around those people. You may love them. They may be people that you're very close to, but they're bad for you, and they'll make your depression worse. And I've actually had that happen to me. I went out to spend some time with friends. I had to walk out because they were being mean to me. And it was just making me worse at a time when I needed positivity and support. And I probably should have said something to them, but I didn't have the energy to do that. And it's hard to get people to understand if you've never been in a depressed state. There's a huge difference between what people say sometimes about, oh, I'm depressed, and between somebody who's sad and somebody who's grieving and somebody who's depressed. Those are not identical. Now, sadness can lead to depression. Grieving can lead to depression. But there's a big difference. And if you're not sure, you need to see a qualified professional, not a doctor, but a qualified professional, a psychologist or psychiatrist. If that person makes you feel comfortable, if you feel like they're trying to manipulate you, move on and find somebody else to help you. Okay? These people should be supportive, but they should not be trying to manipulate you. They should be trying to help you. They should be asking you the questions that help you to understand what's going on inside of you, not directing you morally and ethically. Because this is not a moral or ethical issue unless you are depressed because you are behaving immorally or unethically. And then they need to help you to understand, if you behave in a way that you believe is immoral or unethical, it's going to set you up for psychological problems, including depression. Okay. So during that 6 months, again, it allowed me to see how my brain should be behaving. So when I ran out of money to be able to continue to get that medication after that 6 month period, I was able to refer to that period of time to help me to realize when I was starting to slide down into depression and stop myself and pull myself back out. I'm not saying this is easy to do, but some people can do it. Now, if you say, I can't do it, there's no way I can do it, well, you automatically have lost the fight before you even tried. There's no harm in trying, but there is harm in not trying. So I identified when my mood was starting to slide downward, and I would pull myself back out. I would refuse to sink down into that hole, because when you get down into that hole, it's a very deep hole and it is sheer walls. It is very hard to get out once you're in. But if you feel yourself starting to slide in, you can pull yourself out right away and say, nope, not going there. No, I'm not allowing. You have to fight for your life, because it is a fight for your life. It is. And that's the gift that nortriptyline gave to me and has helped me throughout my life, except for when things got too hard. Because once you've been in a depressed state, or genuine depressed state, you are at risk for becoming depressed again many times. So that was an important tool that I learned. Now, if you don't have that ability to get antidepressant medication and you weren't depressed at some point in your past, you can refer to that point in your past when you were happy and use that to help you to identify, oh, I'm getting depressed, got to pull myself out again. You just have to remember that time in your life when you were not depressed and use that as a guide star to say, oh, nope, not going there. I'm not going back down into hell. Pull yourself up. Pull yourself out. And that was the gift that an antidepressant medication gave to me. And I have been fortunate in that every antidepressant medication I have had has done that for me. However, I wasn't on nortriptyline long enough to discover what the negatives were to it. But the next one that I can recall having taken was escitalopram. I'm not sure exactly how to say it. That medication also was able to pull me up out of depression. However, I had problems with anxiety, and I also had problems with not erectile dysfunction, but the inability to, and again, this is a mature thing, but an inability to ejaculate. And I eventually realized that the escitalopram was the cause of those problems. I got off the medication, those problems went away. Then, after that, I was on and off of sertraline or Zoloft for years, and I recently got myself off. Now, I do have to warn you, with many antipsychotic medications and antidepressant medications, steroidal medications, you must be very careful about getting off of it. You should always consult with your doctor and your or psychiatrist or psychologist or and a pharmacist to get from them knowledge about how to what is called titrate off, which is to slowly decrease the amount you're taking until you're at a safe level where you can stop entirely. Now, I would say I would talk to a trained professional before I trust what a pharmacist will tell you. And the reason for this is because trained professionals like psychiatrists and psychologists should have actual experience with patients, whereas a pharmacist doesn't have patients and they don't have necessarily that information unless people come back to them and say, hey, you told me to do this, I did it. It caused problems for me. So when I got on Zoloft, I noticed it helped me with with depression. It also seemed to help with anxiety. But I still had anxiety while I was on Zoloft or sertraline. And as a consequence, I had to learn mechanisms. I had to learn methods to fight against the anxiety, which is a part of my life anyways. Whether I'm on or off of Zoloft, it's there. It's just that it's worse when I'm not on Zoloft. And situations that make me that are confrontational situations that are where I'm being treated unfairly, or I'm being, some people say gaslit, or I'm being deceived or manipulated, will trigger my anxiety and will make me not fun to be around. Because when I get anxious, I get angry. And I'm not saying violent, I'm just saying I get upset with people. I start yelling. I start swearing. Because I don't feel heard. I don't feel believed. I don't feel that they're going to do anything. And this is a big problem at my workplace, because that is the behavior of management at my workplace. That is the behavior of leadership at my workplace. So when I talk to managers, I often get into that state because they're demonstrating that they're not listening. They're being argumentative. They're not going to take action, or they say they're going to take action and then they abandon me. So, on Zoloft, I was not depressed, although even with Zoloft, there were tendencies toward depression when the situations at work got bad enough. But more often than not, it was just anxiety that was being brought out of me. However, eventually, I was trying to, for years now, diagnose a medical condition I was experiencing, in which I would sometimes, especially when I was sitting, doing something, especially if it was boring, I would start falling asleep over and over and over again. People would say, oh, that's narcolepsy. That's chronic fatigue syndrome. That's this or that or the other thing. And none of the symptoms matched up with what I was experiencing. And the only thing that would help would be if I took a nap, which is bizarre because a nap isn't going to fix sugar blood levels. Blood sugar levels. A nap is not going to fix that. And I knew from prior lab tests that my HbA1c was fine. There was no indication that I had diabetes except this weird thing where it seemed like I was going into hyperglycemia followed by hypoglycemia, or maybe it was hyperinsulinemia followed by hypoglycemia. But there was no evidence that from the labs that were done on me that was what was happening to me. But my doctor never pursued it to the point where it could be pinpointed exactly beyond no diabetes if I was experiencing any of that. Now, I did recently talk to a doctor who is retired, but and she's unfortunately not as sharp as she used to be. But she stated that if you're not diabetic, you're not going to experience hyperinsulinemia followed by hypoglycemia. And so I'll take that on face value because I'm not a doctor. Diabetes is not my area of expertise. But I kept on experimenting with diet and things like that. I experimented with what I was eating. I experimented with what order I was eating things in. I used the advice of the glucose goddess about what order to eat things in. So I started with vinegar and water, followed by leafy greens for fiber to slow down the introduction of sugar into my bloodstream, followed by avocado beverage to help introduce fat into my bloodstream, which would further retard the introduction of sugar into my bloodstream, and then finally carbs. And the vinegar didn't seem to make a difference. It didn't seem to make a difference if I was getting the greens or not prior to the fat. It just seemed to be enough for me to have the avocado beverage and then the carbs. But it wasn't always... I mean, it helped, but it didn't always seem to help enough. And if I didn't have that avocado or some other fat source or some other fiber source first, it didn't seem to have a long-term impact. I was still susceptible to having these incidences where suddenly I was very, very sleepy and only a nap would fix me. So after exhausting all these possibilities, and I started to feel like, oh my God, am I like fructose intolerant? And then learning more about fructose and how the body converts that into glycogen, which is glucose. I came to, I was like, no, it's still, I don't have diabetes, so it doesn't matter if the fructose is being converted into glycogen. I'm not diabetic. So then I was like, okay, is it the Zoloft? And I consulted with my pharmacist. My pharmacist said, titrate down, and within about 2 weeks, you should be able to get off the medication. He didn't really seem to consider carefully enough how long I had been on the medication. And I say that because I did it, instead of for 2 weeks, I did it for 3 weeks. I titrated down slowly. When I stopped I began to experience this kind of dizziness. It was not the kind of dizziness like a drunkard or where you're tipsy, where you're kind of wobbling around, but it interfered with my cognitive ability to an extent. It did not stop me from being able to drive safely. It did not stop me from being able to perform my job, but there was definitely still some brain fog, and I forgot to mention that. That was part of my experience, was brain fog, lethargy, and extreme sleepiness. And I actually got written up last year in November at Amazon because of this symptom. I even informed my manager and HR and my general manager and my operations manager that I have an unknown medical condition. They didn't care. I was put on a final written warning. There was no sympathy whatsoever. And so even though, according to Amazon policy, they could have helped me, they did not. And that was very, very disappointing. And even when I went to them, they screwed me over. But so I titrated off. And during the period where I was still experiencing the withdrawal symptom of this dizziness, and over time it went from being stronger and frequent to less strong, and finally to it wasn't constant. It was on and off. And over time it became less frequent that it was happening, and eventually it just stopped. But in that period where I was still experiencing that withdrawal symptom of that dizziness, I would still experience this extreme sleepiness. But once that stopped, once I got past that withdrawal period, I stopped having that symptom. So the Zoloft was in me, helping me with depression and, to an extent, anxiety, but it was creating this extreme sleepiness when I was not physically active. When I was physically active, I would still yawn a lot. I would still feel kind of a little bit sleepy, but I was able to physically perform as per normal. But during that period when I was going through the withdrawal, that was harder for me when I was physically or not physically active. It was harder than being on the Zoloft. And once I got off of it, I was back to normal. But now I have problems with my feet, my ankles, my shoulders, my knees. So I have physical challenges that make it hard for me to do my work. But getting off Zoloft fixed that problem of extreme sleepiness combined with lethargy, combined with brain fog. And that was my experience. My daughter had a less good experience where for a period of time it seemed like it was kind of helping her, but not enough. Once she got into the stressful situation of going to university, her depression again started to reassert itself and make her depressed to the point where she was failing most of her classes. And she's still trying to struggle with the consequences of that. She's trying to get help, recognition from her university so they can forgive her, because she was on a full ride. She's a smart girl, very smart girl, and she was more depressed than I've ever been in my life, where she had no passion for anything, even the things that she was passionate about. Life was just gray, And I've talked to people who've been on lithium for bipolar, and it's similar to that, where everything is just gray and just destroy. It's just not fun at all. And so that was her experience, where it helped until she got into a situation that was stressful. But it didn't help a lot, even when she wasn't stressed. And so she wasn't functioning right. She wasn't taking care of her environment. Now, people once, when I put out the video last month about being in financial distress, people were saying, "Oh, it's the mess over here." No, that's my inventory for my tech channel. That's not my mess. Am I totally tidy? No, I'm not totally tidy. However, there's a great deal more organization than you can understand. And there's a limit to the amount of space I have available in my apartment. So I have to keep things over here in my apartment, in my bedroom, because I don't want them cluttering up the rest of the apartment, because I've got enough of my inventory in the rest of my apartment that I don't want it to spill over into there. And I don't it doesn't bother me that I've got inventory over here because I know what it is. I know where it is. It's okay. So, but people were saying, oh, you've got to clean it up. What a disaster. No, this is not. I've seen a disaster. I've had friends and family who you walk into their bedroom, their apartment, and you're like, oh my God. This is like walking, almost as bad as walking into a hoarder's apartment. And I've been in hoarders' apartments. It's horrible. I mean, legitimately horrible. It's a health hazard. And I've helped people who have been in that situation. So my daughter was sinking into that disaster kind of look in her dorm room and in her bedroom, her home, because of how badly depressed she was. She, there were times where she would clean up and it would look beautiful and I would compliment her, and then she'd just sink back into that depression and it would go back to looking horrible again. And it was even worse at university because the Zoloft wasn't helping her, and she was not communicating with me as to how bad her struggle was. And so she was not, because of how deeply depressed she was not seeking out help, which she desperately needed. And it got to the point where second semester she's failing again. She finally tells me I'm failing again, and I have seen her apartment, and her dorm room, and I've seen how bad it looks. It's worse than her bedroom ever looked, and then I was finally able to get her to start communicating with the university to let them know she was forgiven for her second semester. And I said, did you ever do that for your first semester? No. Okay, these are the steps I want you to get out a pen and piece of paper, write these steps down. These are the things you need to do. And then I had to follow up with her and say, hey, did you do those things on the list? Well, yes, I did, but... And then later on, she'd admit she didn't do all of them. So then I had to say, look, I understand you're struggling right now, but you need to do those things. And I keep on following up with her. When you have a loved one who's depressed, do not expect them to reach out to you for help. They're not going to. Either they're going to be in denial if it's a light stage of depression, or even medium light, light medium. They may deny. Even in the medium phase of depression, they may deny they have depression. So they're not going to reach out because they don't want to believe that they're depressed. And when they get to that medium phase, it's at the point where they're not going to reach out anyways because they're too depressed to have the energy, the motivation to reach out to you for help, to reach out to you for support. And you cannot be negative with them. You may look at their apartment and you say, oh my God, how can you live like that? You are not helping them. You're hurting them. You must pump love into them. Now, this doesn't mean you ignore what's going on around them, but you have to be positive with them, supportive with them, gently, sensitively guide them. And I recently had a problem with a cousin of mine and her husband, wherein I was accused of being a bad dad. And yes, we were visiting them because my daughter was depressed, and they had invited my son and I to come over to help my daughter. So they opened their home up to us. And during that time, the behavior of my children bothered them because they were getting ready to sell their house. And I apologized, and I said, look, I wasn't trying to be disrespectful. I was disrespected by them. I was accused of being a bad dad by them. I was yelled at by the husband. He apologized for yelling, but he did not apologize for anything he actually said to me, for accusing me of being a bad dad, for accusing me of being disrespectful, even though I told him, yes, we were wrong. I'm sorry. That was a mistake, but I was not being disrespectful toward you. You, however, forcing your religious beliefs on me was disrespectful because I have told you guys many times that I don't want to hear it. I'm not interested. It doesn't matter what your religious beliefs say, that you should be proselytizing me. You don't have that right to proselytize me after I tell you to stop. And that has driven a wedge between us because he never apologized for his behavior. I did. My kids and I all wrote notes before we left that day, the next day while they were in church. We all wrote notes apologizing. They never apologized. So anyways, that's my daughter. She's now on, I think, Wellbutrin or Prozac. And apparently she's doing better, but I keep on checking up on her anyways because I want to make sure she's still not following through on things that she should do. And I'm concerned that that medication is not going to work out well enough for her. Now, my son, he became depressed. And again, this is a kind of a family thing. You go through puberty and suddenly you start having these mental health issues that you didn't have before. My son is a very social person. He's very good at socializing with people. He is very charming, but he started experiencing depression and anxiety, and eventually it got to the point where he came to me and said, "Dad, I've been depressed for like a year now." I said, "Why didn't you tell me? I warned you that this was going to happen. Why didn't you? You should have come to me." So I got him on Zoloft. And initially, he was doing better. But at some point, it started to reverse. His body started to or brain started to react adversely to it. And he became suicidally depressed. And finally, he admitted this to me. And I took him to a children's hospital, and they didn't feel he was bad enough to be admitted. And then a month later, it was even worse. And I didn't know that it was the Zoloft that was doing it. And he was like, "Dad, you got to get me in the hospital." And I was really depressed at that point too. And we had a really extremely negative experience at Mercy Hospital in Batavia, Ohio, where we had been sent by our PCP, our primary care physician. It was very negative, It made me extremely anxious. It made me upset. It made me depressed. It made me angry because of the behavior of the doctor, of the police officers that were there to protect the medical staff. And I understand what they were there for, but they were behaving in a very intimidating way, standing there as I'm conversing, saying, "Hey, I'm going to take my child to Children's. I came here voluntarily for help. You're not helping me. And you're not going to help my child because you say you don't have a person who can help my child. So you say my child needs to go to Children's. Instead of putting him in the ambulance, I will take him in my car. Because if you can't help me here, or him, and you can't help my son here, I will take him to Children's myself." And they were making it extremely difficult. They were threatening me and basically intimidating me by saying, "Well, if you don't turn up at Children's, we will call the Child Protective Services." I was like, "Okay, that's fair, but you need to let me go and take my son to the hospital." Well, just and multiple people said this to me. "If you don't show up at the hospital, we will call Child Protective Services." I was like, "Okay, fine, that's okay with me because I'm going to take my son there, and you will know that I've taken my son there. There won't be a problem." And I understand that they've had experiences where parents have said that and didn't do it because the parent was also suicidal and decided to off themselves and their child. But it was extremely distressful what I experienced. And when I forced the doctor to relent and let me take my son, she said, "Okay, I'm reporting you to Child Protective Services if you take your son to the hospital." I said, "Wait a second. Before you said, if I don't show up, you'll report me. And now you're telling me you're going to report me anyways." "Yes." "Okay, great. Now that I know that you lied to me before, I'm still taking my son." And so then they tried to delay and delay and delay. So I'm sitting here in a hospital bed because that's where they put me after they had me in the psych ward for evaluation, where I was totally non-confrontational. I wasn't even looking them in the eyes because I was afraid they thought I was some kind of a nut job that needed to be locked up for however long and medicated to the point of being a zombie. I was terrified. This was not an intake where they were interviewing me and treating me like, it was just, and I understand they deal with horrible messed up people who are threatening them, who are throwing shit on the walls and stuff. My apologies for the swearing. But I was not doing anything confrontational. I was asking their questions. I was telling them that I had taken some sertraline before I had come here, and I was already starting to feel better. I was being totally cooperative. I was just not looking them in the eyes because I was scared. I did not want to give them any reason to think that they needed to commit me, because I didn't go there to be committed. I went there for help. That's it. And then they put me in this hospital room, and they're refusing to let me have my son. They're refusing to let me have my son. They're threatening me with this Child Protective Services threat. And finally, waiting, finally I pulled this, I think it was a nurse aside, and I said, look, I'm leaving now. Please give me my discharge papers because you can't hold me. You have no legal right to hold me at this point. And the nurse said, okay. And so he went, and the doctor tried to delay. And I said, so finally, I went over to the front desk. I said, look, you have no legal reason to hold me. And you have admitted that. So I need my discharge papers right now. I am discharging myself as per my rights. And I think there's a police officer standing there at that point. And I said, am I right, officer? And the officer said yes. Or at some other point, the officer confirmed that I had the right to leave. And so then I waited, and finally they give me my discharge. And they said, and I say, well, I'm taking my son to the hospital. And they're still trying to threaten me with the Child Protective Services. And finally I said, look, I have told you this is what I'm going to do. I am a man of my word. I will take my child to the hospital. I brought him here for help. You are not helping him. You're feeding him junk food. You're feeding him crap. You don't even have proper food. I will take him to a restaurant, get him proper food, and then I will take him to Children's Hospital. This was the first time, not the second time. This is the first time. Or sorry, this is, whatever. Anyways. So she calls up Child Protective Services and says, they're going to be calling you. They're expecting you at the hospital. If they don't hear from you at a certain time, they're going to call you. And I said, okay, just let them know I'm going to be going to a restaurant with my son because we haven't eaten. We didn't have dinner. And we've been here for I think it was like 5 hours at that point. And finally, after a lot of protesting on my part and insisting on my rights as a father, I was saying, are you refusing to remand my child to me, the father, the parent? She said, no. I said, well, then give me his discharge papers. I am discharging him. You do not have a right to hold him. I will take him to Children's. I will get him dinner and take him to Children's. And she was very difficult. It was a very negative experience, very distressing for me and for my son as well, because he had a young lady sitting there for most of the time that he was there, talking to him, trying to keep him calm, being very nice to him, and that was great. And when I said to them, hey, he hasn't eaten for hours now, can you please give him something, that got him food? But it was crap. And he was not happy with it. And I said, look, son, do you want to stay here and have them transport you by ambulance? Or would you like me to take you to a restaurant and then take you to Children's Hospital? He said, I want to go with you, Dad. I want to go to a restaurant and I want to go with you. I said, okay, you heard him. This is what he wants. This is what I want. This is what we're doing. And finally, they gave me the discharge papers. While we're at the restaurant, in contradiction to the time frame that I was given by the doctor, Child Protective Services calls us and says, what's going on? I said, well, we're waiting for our order. We're at such and such a place, and we're sitting here waiting for the order. And because of our dietary restrictions, it's taking longer than normal, I guess. And he said, okay, well, if I don't hear from you by 12:30, we're going to be looking for you. I said, you don't have to worry about it. Well, I'll probably be there around 12. And he said, okay, if you can be there before 12:30, everything's going to be fine. So we get our meal, we eat our meal, we get to Children's Hospital a little bit after midnight. We get checked in. We are escorted by a CPS officer to the psych ward for my son to be evaluated. And while we're in the psych ward, my daughter and my nephew call me up saying the police are at the door. I said, what? I'm at the hospital. Why are they calling me? Why are they bothering you guys? And my nephew was with my daughter because he was worried about her because of what was going on with us. So he stayed there overnight, actually, to make sure she would be okay, which was a wonderful thing to do. And I'm so thankful that he did that for her. So I say, look, put the officer on the phone. And so he put the officer on the phone, and I explained where I was. And I said, do you want to talk to the CPS officer here? He said, yes. So I gave him to the CPS officer. They communicated. Problem was done with. Those officers left my daughter and nephew alone, and we went on our way to for the evaluation. My son was committed and I told them, get him off the Zoloft. He has become suicidal because of the Zoloft. And they were saying, well, we have to titrate him off. I said, he's only been on it a couple of weeks. Please get him off now. So then they finally, I think the next day, got him off. He was in the psych ward for a week at a different facility, and they treated him really nicely. He earned privileges. And it happened to be the week of his birthday. So we all visited him while he was in the psych ward. And he was in a really good mood. He was very happy that we all came, although we couldn't all come at the same time. And we spent time with him. And I was there every day visiting him. I think, or almost every day. I think some days there were that either he didn't need me to come or I wasn't unable to attend because of my work schedule. You know, I get up very, very early in the morning. I go to bed very early in the evening, and after I think 8 days, he was released to me, and he was on Prozac, and he got to a point where he didn't need the Prozac anymore. He got himself off the Prozac. And it was a big deal, but he ended up being okay. So this Zoloft was horrible for my son, mediocre for my daughter, pretty good for me. I've never used Prozac, but Prozac helped my son get to a point where he was on an even keel again. Still screwing up at school, but that's a totally different story. So the reality is, and parents, you need to listen to this very carefully. For yourself, if you're going to get on an antidepressant or any other medication dealing with psychiatry and psychology, and for your children, you must be very careful to monitor your kids to make sure they are not becoming worse, to make sure they're not hallucinating, to make sure they're not hearing voices in their head, to make sure that they're not having suicidal desires, to make sure that it's not doing the opposite of what it should do, because these medicines in some people will do the opposite of what they should. My wife, if you gave her caffeine, would become sleepy. My daughter becomes sleepy if you give her caffeine. My son sometimes becomes sleepy if you give him caffeine. You give me caffeine, you wake me up. If I keep on drinking caffeine throughout the day, I don't sleep well. But my kids have a different gift, so they react differently. So maybe that's why they only got some of my genes, so Zoloft works better for me than for them. So clearly, it seems like Zoloft would not have worked at all well for my wife when she was depressed while she was struggling with cancer. So you have to be very aware. If the way your brain is working is getting worse in some way, you need to talk to your doctor immediately and say, this is what's happening to me. This is not good. If this is happening to your child, same thing. And again, you have to be careful. Your child may need to be committed until they can be titrated off if they were on the medication for a long enough period of time. If it was a short duration. Now, again, I've gone through withdrawal for a steroid medicine that I was on for my allergies, and I was on it for 7 years. I was having lots of different symptoms of how steroids can break down your body, and it took a long time for my body to recover. And some of the symptoms went away within months. Some of the symptoms, it took 1, 2, 3 years. But you have to be careful. Not all antidepressives are the right ones for you, for your kids. And just because it works for you doesn't mean it works for your kids. And if you're just going to the pharmacist for advice on how to get off of a medication, pharmacist is not the best source of information. You're better off talking to a doctor. Better off than that is a psychiatrist, or or, well, a psychologist is better than a doctor. A psychiatrist is better than a psychologist. You have to immediately reach out to somebody. Do not wait. And keep in regular contact with your child. And your child may not be forthcoming with you, but you have to look for the symptoms that you can see their behavior is getting worse again. So I hope this helps you. Depression is a horrible, horrible thing. I mean, there are worse things like APD and BPD and DID, and I think sometimes bipolar can be worse. But this is definitely one of the worst psychological disorders you can experience. And it's not just in their head. It is a chemically based disorder, okay, that causes disruption and reformation of the nerves in the brain because the chemistry causes the way your brain thinks to change, and that causes a reinforcement of different neural pathways than what you would use if you're thinking normally. So you're fighting chemistry and physical nerve connections. Okay? To get through that on your own without medication takes a huge amount of willpower. And the only way for most people is to not allow yourself to get into that state in the first place by fighting it when you see the first symptoms. A lot of people do not have the willpower. I don't have the willpower. So if you're stuck in that situation, you need medication. And some medications you will be on for life. To antidepressants, you don't necessarily need to be on for life. But like BPD, APD, DID, that's going to, schizophrenia, schizoid affective disorder, those things are generally going to be something you have to treat for life. So, yeah, I hope this helped. If you have questions, you can try asking me. I may be able to give you some more advice. However, I definitely suggest that if you are experiencing or someone you love is experiencing behavioral issues, that you should get professional help. I'll give you one further example that I was given by somebody that I worked with. She had been married and in a loving relationship for many, many, many years. And her husband was put on a medication. I don't remember what the medication was. He became extremely abusive to the point of physical abuse, to the point that their son said, "Mom, you need to get out of the house. He's going to end up killing you." Because the father, the husband, had actually ended up beating her and kicking her in the spine so that she had permanent spinal damage. And eventually she got out of that situation, and it's a good thing because he would have killed her otherwise. I don't think at least the last time I saw her, he was still on that same medication that was turning him into a suicidal maniac. Or not a suicidal, but a crazy man, a dangerous, dangerous man. And I really hope that she's okay because she was a nice lady. So that's it. Thanks so much for watching, and I hope you have a great day.